Well, at this time last week, the number of cases in El Paso was 1,456 with 41 deaths. This week, the number of active coronavirus cases increased by 112 and 14 more people died. In an effort to better chart the spread of COVID-19 in the borderland, ABC 7's Mauricio Casillas is checking in with the same doctor each week to see how things are changing. It's a segment you'll see only on ABC 7.
Dr. Jose Burgos and the rest of the healthcare workers at UMC have now been on the front lines of this pandemic for 2 months. He says that with each day that goes by, he and his staff are learning more about this deadly disease and how to treat it. Just like last week, I asked him the same 7 questions. Here's what he had to say. How has this past week gone for you?
The volume was steady, which is a good news. We are still expecting the spike of admissions coming from patients who might have been exposed over Mother's Day weekend.
Can hospitals handle the current number of patients?
As of today, hospitals can handle the number of cases that we are seeing right now and the ones that we might potentially see over the next few days.
What should people at home be doing right now?
I have seen a lot of videos on social media of people refusing to wear masks. Masks are not only to protect yourself from others, but to protect others from yourself. Remember, I have been telling you for the past few weeks, pretend that you're the one who's sick. You don't want to get other people sick.
What's the most eye-opening thing you've seen this week?
A healthcare worker who was sick for over the past couple of weeks. I have been personally treating that person, and he's in the hospital now. We're treating him in the hospital. Fortunately, that person is doing well. I'm sure that we'll be going home sometimes over the next couple of days, but that's eye-opening. That person could have been me.
What's your prediction for next week?
We might see some of those cases from Mother's Day. Memorial Day is coming also, so remember, practice social distancing. Things are not back to normal. The virus is still there. The virus is out there. If we look back on March 13th is when we have our first case in El Paso. Remember that now we have more virus out there than what we had at that point.
What is giving you hope at this time?
Most of our patients are doing well. We're very happy to see how they are improving and how they are going home.
What's your message to the borderland?
This is a real condition. It is not made up. It is not something that somebody just came up with just to make people afraid. This is very, very real.
Right now on KVIA.com, you can go back and compare how the spread of coronavirus has changed from week to week and how Dr. Burgos' answers have changed as well. Just search check-in on our website. Mauricio Casillas, ABC 7.